Hello and welcome to the channel. If you're experiencing joint pain, maybe in your knees, hands, or back, and you're wondering what's really going on, this video is for you. Today we're diving into a question that confuses many people. What's the difference between osteoarthritis and rheumatoid arthritis? Both can cause pain, stiffness, and swelling, but their causes, progression, and treatments are completely different. Understanding these differences could change the way you care for your joints and even prevent long-term damage. So grab a cup of tea, get comfortable, and let's take a closer look at your joints and what your body may be trying to tell you. Did you know that osteoarthritis and rheumatoid arthritis are two completely different conditions in causes, symptoms, and treatment paths? Many people think joint pain in older adults is just arthritis, but the truth is treating the wrong type of arthritis can make things worse, not better. In this video, I'll walk you through the key differences between osteoarthritis and rheumatoid arthritis so you can understand what's going on in your body and take smarter steps to care for your joint health. Medical definitions. Let's start with what these two conditions actually are. Osteoarthritis is a degenerative joint disease. It happens when cartilage, the cushion between bones, wears down over time due to age, joint stress, or injuries. Rheumatoid arthritis is an autoimmune disease. The immune system mistakenly attacks your own joints, causing inflammation, swelling, and joint damage. In short, osteoarthritis equals wear and tear. Rheumatoid arthritis equals immune system attack. Two causes and pathogenesis. Now let's look at what causes each of these. Osteoarthritis is caused by aging, joint overuse, obesity, and previous injuries. It's more of a mechanical issue. Rheumatoid arthritis is caused by immune system dysfunction. Genetics and environmental triggers like infections or smoking may play a role. In osteoarthritis, cartilage breaks down. Joint space narrows, bone rubs on bone, causing pain. In rheumatoid arthritis, the immune system inflames the synovial lining. It thickens and invades cartilage and bone, leading to joint destruction. 3 clinical symptoms. Both conditions cause joint pain, but the pattern is very different. Osteoarthritis affects weight-bearing joints like knees, hips, spine, and thumbs. Pain worsens with activity, improves with rest. Morning stiffness is brief, under 30 minutes. Rheumatoid arthritis affects small joints symmetrically, like fingers, wrists, and feet. Pain is worse in the morning and may persist at rest. Morning stiffness lasts more than an hour. Joints may appear red, swollen, and warm to the touch. For diagnostic tests, we also use lab and imaging tests to tell them apart. In rheumatoid arthritis, blood tests often show high inflammatory markers, CRP and ESR, and antibodies like rheumatoid factor and anti-CCP are usually positive. In osteoarthritis, these markers are typically normal. X-rays help too. Osteoarthritis shows joint space narrowing, bone spurs, and subchondral sclerosis. Rheumatoid arthritis shows bone erosions and joint space loss, often in a symmetric pattern. 5 treatment options. Treatment depends on which type you have. Osteoarthritis treatment focuses on pain control with acetaminophen NSAIDs or joint injections. Physical therapy and weight loss are critical. In advanced cases, joint replacement surgery may be needed. Rheumatoid arthritis requires early use of disease-modifying drugs like methotrexate. Biologic medications are used in more severe cases. The goal is to suppress the immune attack before joint damage becomes permanent. Note: always consult your healthcare provider. Do not use any medication without professional guidance. 6 complications if left untreated. What happens if you don't treat them? Osteoarthritis may lead to chronic pain, reduced mobility, and eventual joint replacement. Rheumatoid arthritis, if ignored, can deform joints, affect organs like the heart and lungs, and cause disability. That's why early diagnosis is so important. 7 final thoughts and doctor's advice. To sum up, osteoarthritis is more common, especially as we age. Rheumatoid arthritis is less common but more dangerous if not controlled. If you have persistent joint pain, especially morning stiffness over 1 hour or swelling in multiple joints, don't wait. See a rheumatologist or joint specialist. Leave your questions in the comments. I'll do my best to answer. And don't forget to like, share, and subscribe to stay updated with more joint health insights. Until next time, take care of your joints because healthy movement means a healthy life.